During the last decade, Ohio has seen the third largest rate of deaths from opioid overdoses. We're behind only West Virginia and New Hampshire. But there's finally some positive news in this drug crisis, and our 11 Investigates team will tell you about it tonight at 11. But lead investigator Brian Duggar joins us now to give us a preview. Brian, opioids used to be in all the headlines all the time. We kept hearing about it. Why do you think we're here now?
Yeah, I used to write about this back at the Blade, when I was there in the 7 years ago, 8 years ago, and I used to write about it, so it's in the headlines all the time. But right now, I got a tip from someone, actually the coroner, who had said, hey, we're seeing a lot fewer overdose deaths than we've seen in years past. So I kind of pulled the numbers on that. And so between 2023 and 2024, overdose deaths went down like 35%. And then this year, they're down even more significantly. So that was kind of the genesis of the story. I'm like, okay, I'm going to tell a story about overdose deaths are way down. But then it kind of took a different direction. And we kind of, as you'll see tonight, we go through all the phases of the drug crisis. We talked to a lot of people for this story, addicts, people that are on the front line, mental health agencies.
Well, let's unpack that, though, because we have Narcan that is now readily available.
Yeah.
And also we're getting more out of the COVID pandemic where depression was rampant. I mean, I don't care how good or bad you seemed, nobody was okay. Alcoholism or abuse of alcohol was up, abuse of drugs was up, and plus at the same time we also legalized marijuana in Ohio. So there's a lot of different currents to why we're here.
And you really nailed it, because we really did see the overdoses and the overdose deaths really start to spike around 2019, but then 2020, 2021. I mean, 2021, I talked to the EMS supervisor and he said firefighters, they're running the wheels off the rigs, and they're often going to the same house over and over. He said sometimes they would save somebody 6 different times in a week.
Wow.
You go out there, Narcan them, bring them back to life, and you're right. During the pandemic, there's a lot of depression, and people were trying to numb their feelings any way they could, whether it's alcohol, or drugs, unfortunately.
Okay, so opioids and fentanyl were the primary cause of the overdose deaths then. The ones that we're still having, is that the case? Or what trends are you seeing in these numbers?
Yeah, so this is really interesting because we've seen fentanyl in the community go down quite a bit. It's obviously still out there. It's an extremely powerful drug, and it can be very lethal if you overdose on it. But, I pulled the Ohio State Highway Patrol numbers. We're seeing a lot fewer fentanyl confiscations. People I've talked to, they're not running into it as much. But what we are seeing, we're kind of seeing a resurgence of methamphetamines, and cocaine has been going up quite a bit. I saw a headline, I think last week or earlier this week, about a big cocaine bust on one of the highways, and so you look at the numbers, fentanyl way down, cocaine way up.
Well, there's been a greater effort to identify fentanyl sources, the Mexican cartels, right now Venezuela, China, they're cracking down on the shipments in there. So that helps the supply go down on that. But yeah, at the same time, meth, meth is made domestically pretty much, so I guess drug addicts will go where they can find it?
Yeah, and that's interesting. I heard multiple people tell me during all these interviews, it's kind of like playing whack-a-mole.
There you go. Yep.
You smack, so there's a lot of focus on fentanyl, you smack it down, and methamphetamines pop back up, cocaine pops back up, alcohol and weed have always been pretty consistent. Weed's obviously legal now, and most people aren't addicted to it, but it can. The people I talked to, they said people may start with weed and then go to something a little stronger.
We're getting low on time, about a minute left, but the county's done a really good job of working to try to bring this down. What do you know about this in the story?
Yeah, this was the thing that really impressed me in putting the story together. You have the DART unit. People forget about the DART unit, but Sheriff Tharp started this back in 2014, And, there's fewer people on the unit now, but it is really pivotal in dealing with this. Mental health agencies, Lucas County Health Department, like you said, I mean, you can get Narcan for free. So mental health agencies, Lucas County Health Department, the fire department, there's a really cool heat map where they're able to see where all the overdoses are happening and then target those areas.
So what's great about what John Tharp was doing was like, okay, put the criminals in jail and people that have drug overdoses or mental issues, they go a different direction to get some services, which is really, I think, changed the game on that. Looking forward to your story tonight. That's coming up at 11 o'clock on WTOL 11.